Let me give you the safe general question first. How is the reopening of the state from Buffalo to New York and out to the Hamptons? How's it going?
Thank you for having me on the show again. It is going phenomenally well. And I say that not just from my position as lieutenant governor, but as someone who literally as recently as yesterday walked the streets. I was in Niagara Falls. I was in Lockport the day before I was in Rochester. And there is such an excitement about reopening and an energy on the streets that I am actually shocked to see, because I thought people would be more sort of depressed and in a dark place after what they've had to endure. And the truth is, this just demonstrates the resiliency of New Yorkers. So the reopening is going well. We've not had complaints. As we reopen, though, we are very closely monitoring our health outcomes and the rate of transmission and our hospitalizations. And if you look at the charts every single day, as I do and the governor does, you'll see an incredible downward trajectory, unlike what we're seeing elsewhere in this country. So the opening is going well. We're in phase 1 in New York City. Most of upstate is now, as of today, just today, is now in phase 3, which is restaurants and more personal services. So people are feeling a sense of normalcy, except they know that it only continues if we keep social distancing and wearing the mask. And all the business owners have been really great about complying.
Lieutenant Governor, perhaps they're in a dark place and they're turning to retail therapy to soothe some of those feelings. I am curious about threading this needle of encouraging people to go back out there and embrace the economy while also practicing social distancing and some of these other measures. How much are you trying to encourage people to come back, and how much are you able to deploy tracers, trackers, to really make sure that people are not super spreaders at this point? We don't see a big resurgence of the virus.
You have hit on exactly the answer to the problem that I'm not seeing going on in the other states that opened even before New York did. And some people criticize us for taking too slow of an approach. Well, we were not going to send a message that any part of the state could open until we listened to not just national experts, but global healthcare experts who've enlisted from London to assist us in analyzing the data to make sure we don't cross that line between risk and reward. We've always wanted to make sure that we are doing this in a smart way. But the answer is testing, and there is no state in the nation that tests more people than we do here in the state of New York, over 50,000, sometimes 65,000 a day. And what happens after the testing is that information goes directly to our contact tracers, an army of individuals, and we thank former Mayor Bloomberg for his assistance with the state of New York, working with our Governor Andrew Cuomo to bring in the resources to allow us to have individuals trained, have them in every corner of the state, even in most rural areas. And I oversee the reopening even in Western New York, the second largest city of Buffalo. But we have incredibly rural areas, small towns, and we have contact tracers ready to jump if anyone tests positive, even in the furthest corner of states down in Allegheny County, Chautauqua County, up in Plattsburgh. So that is what other states should be doing, and that is how we can get control over this virus. And what's frustrating to us in New York is we figured this out. We have led the nation in terms of how we've managed this pandemic. No one has done a better job than Governor Cuomo. And if the other states simply followed our lead, they'd be in a far better place today, because we're going to continue reopening in a smart way based on healthcare data, but we're going to do it.
You mentioned former Mayor Mike Bloomberg, of course, the parent company, Bloomberg LP. He was the founder, majority owner, still is, of course, of Bloomberg LP, the parent company of Bloomberg News. Lieutenant Governor, just to continue the conversation, there is clearly some tension down in Texas. I've spoken to the administration, and they've suggested to me that the bar is higher for another lockdown. Quite clearly, you've suggested that to us as well in the last several weeks too. I'm just wondering if you can establish some guardrails for us, the kind of data that you would need to see to reconsider locking things down again.
Well, we've said we don't expect to go there. And again, this is why we did it right in the state of New York. And I can't emphasize that enough, that there was another alternative, which was to listen to the many voices who were saying, you know, we're short on revenues. Our counties can't function. You know, the state of New York is in dire straits in terms of the loss of revenue coming in during this 3.5-month period. But we are never going to sacrifice people's lives and public health. And so what people have to look at, when you can go right to forward.ny.gov, you can literally pull up regional dashboards to see the metrics that we're examining. And the one that's most important now is the rate of transmission and how we can determine what the testing rates are showing. And if you look at a place like Western New York, A few weeks ago, it was 9% of people were testing positive. That number is now 0.8%. That's extraordinary. And you look at New York City, where we had 25% testing positive not long ago, and the numbers are down to 1%, 2%, 3%. Higher in certain neighborhoods that we're putting a laser focus on. Communities of color have been harder hit, and that's why we have even more testing and contact tracers deployed there. But it's not that hard. We followed what the Centers for Disease Control had recommended early on in terms of the phasing. I mean, these guidelines have been out there, but very few states were enlightened enough to actually follow them. And so we're feeling not overconfident, but a sense of confidence that this is the right path to be on, and we're going to continue here. And if we see a change in the numbers that are alarming, that's what all of our regional control rooms do. We're watching every corner of the state. Then we'll talk about whether or not we enter the next phase. But thus far, we've not had any holdups. The numbers keep going down.